Hey everybody, it's Doc Adam Nally coming to you live from Waddell, Arizona, northwest corner of Phoenix, Arizona. I apologize for those on Periscope. My lighting works great for Facebook, but not so hot for Periscope. It's late in the evening again. It's the Late Night Ketosis podcast. Hey guys, how are you? I thought I would talk to you about how ketosis relates to insulin resistance and disease. And hopefully that would give you some insight into a little expansion of what we talked about yesterday and expand on that. So as people are logging in and as you're signing on here, feel free to share this out. If you're on Periscope, swipe it right or left, and you can share it. And if you're on Facebook Live, you can go down to the bottom of the screen there and share it out to your friends and those who think that'll help. I'm a board-certified family physician and a board-certified obesity medicine specialist. I've been in practice about 15 years in the Surprise, Arizona area. See a number of patients and treat a full spectrum of disease, cradle to the grave with patients. You got your keto living vitamins, said Keto Amazed. You are very welcome. Hopefully they'll help, and that I've been using them for the last about a year, and they're fantastic. But I wanted to talk to you about disease here, and so what I thought I'd do is let me pop up on the screen a little change here so you can see this. Oops, wrong one there. Let's try this. We'll put that one back up. Oh, it doesn't like that. Oops, wrong. I went to the wrong screen. That's why. All right. So let me pop this up here like that, so that give you a little title what we're doing. How does ketosis help insulin resistance, and how does it help disease? We want to talk about first the issue of what's so magical about ketones. Why do they help? Well, number one, ketones are another fuel source other than glucose or sugar or carbohydrate, essentially is what it is. So ketones are a wonderful source for fuel. And the nice thing is they're a source of fuel that doesn't require insulin. And so in the absence of a need for insulin, the insulin levels can actually drop, and that plays a huge role in many of the diseases of civilization. It also has the ability, ketones themselves have the ability to both act as hormone signals, we're learning, and they also have the ability to act as neurodegenerative signaling properties, actually, we think even affecting the DNA and RNA of our bodies. So pretty profound, pretty amazing to see that. Again, thank you for all those who are signing on for the shares and for all the hearts that are on Facebook Live or Periscope there. So number one, what's magical about ketones? A number of properties in that they lower insulin, they act as not only fuel but as hormones, and also as a neurosignaling property for DNA, which is pretty profound. And we'll go into that more as we go on in future podcasts. Now, the second question is, I'll pop this up on the screen here. How does ketosis help disease? Well, number one, if you remember from our previous podcasts or previous scopes, insulin is the master hormone in driving weight gain. And if we lower the insulin level, even partially, and so that's why you'll see people who cut soda pop out, or people who cut out the cookies, or just stop eating French fries, will actually see a weight loss. And the reason is that they actually start producing less insulin and have less insulin drive that's kicking in. That decreased insulin allows for weight loss. And the amazing thing is that when the fat cells get smaller, they're less sick. There's a term called Adipose Apathy, which is the meaning to fit sick fat cells. And we've now learned in the last 5 to 10 years that our fat cells produce over 100 different hormones, and only one of which actually helps inflammation. The rest of it make it worse. So as your cells get bigger, they get sicker, they get fatter, and that causes worsening of disease all through the whole body. As you shrink the fat cells by producing less insulin and using fat and ketone as your primary fuel, your fat cells can actually heal, and their ability to produce adequate and appropriate hormone actually improves. Second is that we know that part of those hormones drive inflammation, and inflammation is a major factor in metabolic syndrome, many of the diseases of civilization that are out there. And lastly, it gives It gives one increased energy. Ketones actually increase the energy levels and the ability to recover dramatically quicker. Our athletes are starting to see this. And so you are more apt to exercise. When I'm horribly insulin resistant, as I said in the past, and so I produce 10 times the insulin response to food that contains carbohydrate. I was always tired. I was always exhausted. If you get that after lunch feeling of wanting to snooze, that means your insulin spiked and your blood sugar is beginning to fall and you're getting a little hypoglycemic and you feel crummy. So being in ketosis, or ketones as your primary fuel, gives you a much improved energy level, and with that much improved energy level, you're actually more apt to exercise. And when you're more apt to exercise, we know that exercise itself actually improves insulin resistance itself. So that's how ketosis helps disease from a very 30,000 foot perspective. Now, next component is diet really the most underused tool in the primary care office? And I think it actually is. I've been shocked in the last 10 years that the application of the correct diet has actually been more profound than most of the medicines that I prescribe. And how do I say that, or how can I say that? Well, diet is pretty easy. And if you give a person the right diet, they're going to follow it. A lot of people say, well, Dr. Nally, how can you follow a low-carb diet for 10 years? It's so boring. It actually isn't boring. If you're eating what you like to eat and you feel full, it's not boring. And you actually do quite well. And you actually do fantastic. You just have to learn to eat and cook in a way that your great-grandmother used to eat and cook, and it's actually fantastic. Second, everyone eats. Everyone has to eat. And so if you teach people to eat correctly, they're going to eat correctly and they're going to see tremendous improvement overall. Third, it really is the most powerful tool. And I'm going to point that out here in just a minute as we talk about how food can actually be your medicine. But I go to the point of which Hippocrates made 2,000 years ago, saying, let food be your medicine and let medicine be your food. That has become my mantra in the last 10 years of my practice. When should you reduce fats, or is it not necessary? It's not necessary. When you're doing a ketogenic diet, you're pushing your fat intake to 70 to 80% of your total calories. You're lowering the carbohydrate intake to somewhere around 20 or 30 grams per day. And so fat becomes your primary fuel, and your body will tell you, hey, you're full, so you don't need to eat that much. Initially, when I first started doing this, I ate between 3,000 and 5,000 calories a day for the first 6 months of what I was doing, and literally lost 65 pounds. And I see patients do that over and over. Now, once my body started getting used to the fat, I actually had a dramatic decrease in my appetite in general, and I began eating less than that. And so I average anywhere between 2,000 to maybe 3,500 calories a day, depending on what I do and how physically active I am. So, and many of my patients have the same approach and the same effect. Pretty profound. So lastly, last point here that I wanted to add to this evening's scope is this: can food really be your medicine? Can you really make food your medicine? And let me point out what I see on a regular basis and what has literally been profound in the way I practice. Number one, I will often see up to 3.5 points, and this is a percentage point of a test called Hemoglobin A1c. Now, those of you who are pre-diabetic or diabetic and your doctor is checking this Hemoglobin A1c, this is a 90-day blood sugar average. The red blood cell has a little protein on it that has a certain percentage covering the red blood cell. And essentially, when the red blood cell is born and new ones are born, they live about 90 days, and new ones are born every day. We measure the A1c protein on these red blood cells, and it can give us an average for what your blood sugar has been over a 90-day period. And that's what that hemoglobin A1c is. So it's basically your red blood cells are born with a sugar thermostat, and we average the thermostats, and we know what your sugar's been. Well, I will see I've had patients that change their diet alone, drop their A1c by 3.5 percentage points on the A1c. And I see that all the time. Number two, I see uric acid levels drop by a point to a 1.5. Now, insulin turns on uric acid. Uric acid is really cool because it makes kidney stones and it makes gout. And for those of you with kidney stones and gout, it's driven by insulin. And when we turn the insulin loads down, I see dramatic improvement in the risk for gout and the risk for kidney stones. Third, I will see up to a 30-point drop in blood pressure. We've talked before, and you've seen my other scopes, where we talk about insulin driving the sodium potassium ATPase enzyme in the kidney that causes you to retain sodium. And remember, water is like the boyfriend for sodium. It follows sodium all around. And so if you're producing lots of insulin, you're pulling lots of salt back into the bloodstream, and that raises your blood pressure. If you're on a ketogenic diet, you see blood pressure drop. Uric acid is a surrogate for insulin levels. Not necessarily, but you could call it that. If your uric acid's high, most of the time your insulin levels are high too. And I can guarantee, I see that routinely. I have for the last 10 years. I will see 1,000-point drop in LDL particle numbers, pretty profound. And so when you measure the expanded form of cholesterol, the LDLP, small dense LDL particle, those particle numbers, I'll see 1,000-point improvement just with dietary change alone. So you cut out your sugar and start eating more fat, and your cholesterol goes down, pretty down. Pretty impressive. I've seen up to 700 points drop in triglycerides just by dietary change. I don't have drugs that do that. No drug does that I've ever practiced or used in the last 15 years. Dual combination drugs don't do that. I don't see a 700 or 100 point drop with dual combination drugs, but I do with a ketogenic diet almost every day. Pretty profound. I will see a 50% improvement in overall heartburn and reflux symptoms. If you've got heartburn, if you've got reflux, it's often driven by the insulin response to a high carb diet. I'll see 50 to 60% improvement in inflammatory bowel and irritable bowel symptoms in many of my patients. And I will see a 50% improvement in inflammatory skin diseases. So eczema, psoriasis, a lot of the skin manifestations of inflammation that we see will diminish by up to 50%. So these are all things that diet does if you apply the right diet. For the first 5 years of my practice, when I applied low-fat diets, these all got worse. And so what did I do? I gave more pills because that's what we were taught to do. But when you start looking at the patterns that you see with medicine and the patterns that occur with diet, you see a dramatic improvement. Yes, many rashes, inflammatory type rashes, are related to insulin resistance. Now, that doesn't mean every rash is caused by it, but eczema, atopic dermatitis, psoriasis, every one of those I see improvement in by about 50%. So as you lower the starch and carbohydrate intake and increase the fat, we see that improve. Now, rosacea is a different beast, and so I don't necessarily see dramatic improvement with rosacea unless the rosacea is being driven by alcohol intake. And if you drink a lot of alcohol, we'll see that happen, and it'll improve a little bit. But rosacea has another component and a bacterial component with it as well. But it does. You will see the inflammatory effects of rosacea improve if you have some of those inflammatory effects. So, can food really be your medicine? Absolutely. And it's been shocking to me to see how strong a diet is in the last 10 years. What is a typical steady pattern for weight loss on keto after the initial drop? So what I'll usually see, great question, let food be your medicine, let medicine be your food. Yes, exactly. So what I'll commonly see with an appropriately applied ketogenic diet is I will see 5 to 15 pounds of weight loss for the first 3 months. Then weight loss slows to 2 to 5 pounds a month. Now, a lot of people get freaked out because I've had 3 patients in my office today that were just upset because they came into my office after Christmas and said, Dr. Nally, I gained a pound, but their waist shrunk by 1/2 inch to 1 inch. So when we actually measured their body composition, they lost body fat but gained muscle and actually became better hydrated. So their scale weight went up, but they shrank 1 inch off their waist, and they're freaking out because the scale weight's off. And I'm going, give the scale to the neighbor you don't like. Stop looking at the scale because the scale lies. Your waist tells the truth, and that's what we see. So that's a common thing that I see in my office. Now, why does the body slow its weight loss down a little bit after that 3rd month? Well, if you keep losing fat, but you maintain muscle and connective tissue, you're going to look like the Michelin tire man with all these rolls. So the body will slow the weight loss down so that it can remodel that skin and connective tissue over a period of time. And it may take a year or 2 for that to happen. So, but your body has its own natural plastic surgeon involved. It's just a little slower than the one you pay $10,000 to. So, don't be afraid, but measure your waist. Don't worry about the scale. Give the scale to the neighbor you don't like, and as well as the milk and the carbs. And if you've got fishy crackers in your house, wrap them up with a bow and give them to the neighbor you don't like. Great thing to do. How long does PCOS take to reverse after keto? It really depends. It depends on how significant it is, but I see improvement in patients. I've had patients in my office who have polycystic ovarian disease that will be pregnant within 3 months. In mild to moderate cases, in more severe cases, it may take up to a year sometimes. It takes 18 to 24 months to truly reverse the insulin resistance. And if you are severely insulin resistant as a female with PCOS, it may take 12 to 18 months to really see the testosterone levels level out, the hormone levels balance that way. But I commonly will have women come into the office who have not been able to get pregnant for years, and within 3 months of being on a ketogenic diet, all of a sudden they come in and they go, Dr. Nally, I got to change my diet because now I'm pregnant. Well, no, you actually don't. Does coffee or tea kick you out? Only if you sweeten it with sweeteners. And I missed the keto question that was there with that as well. I am going to try and see if it doesn't smash my bandwidth to pull up Facebook Live here and see if there are questions on Facebook Live. So how much water should you drink on keto? I tell people at a minimum, I'm in Arizona, so we drink 8-ounce glasses of water a day, 64 ounces of water at a minimum. And if you're exercising, probably more. Your urine should be the color of tap water. If it's any darker than that, you're not drinking enough. What could cause cravings at dinner time? Too much protein, not enough fat, and too many carbs. Or stress is the other common cause that happens with that. That's actually good questions, guys. Very good questions there. Like I said, I'm popping onto Facebook Live to see if I can find any questions that may be on there. And let me see if I can see if we got some down here. Sleep. So I was looking away for a moment. So let's see if I can pull this. There's a couple comments, but I'm not seeing them. How long does it take to lower the slightly elevated testosterone and DHEA? Anywhere from 3 to 12 months is what I commonly see. Very, very, very good question there. Hopefully my bandwidth is hanging in there as I pull up this on the other side. I'm going to probably have to turn this so I can see these questions roll in here. Maybe. Oh, there we go. Okay. How much fat should we be getting? About 70 to 80% of your total calories should come from fat. Great question. Very good question there. Hopefully that'll help. Very good questions. How much protein? Protein should be calculated, and you can go to my website at docmuscles.com, docmuscles.com, and look on there, type in ideal body weight or type in protein, and it'll give you a couple articles that tell you how to calculate the protein. We calculate your protein based on your ideal body weight, and ideal body weight is based on your height. And that calculation is there. Great questions. Thank you, Jack, for the good comments. Is keto good for gastric sleeve? Absolutely. When gastric sleeve fails, when gastric bypass fails, that's what they end up coming into my office 5 to 10 years later going, Dr. Nally, I've gained 100 pounds back. What do I do? And I put them back on a ketogenic diet. That's how it works. It's great. Somebody asked about how much fat. Like I said, 70 to 80% of your calories in a ketogenic diet should come from fat. If you're just doing low carb, it usually may be 50 to 60%. Some people can get away with that. For me, I truly have to be ketogenic. I have to push my fat content up that high. Thank you for Keto Maze for putting up my website, docmuscles.com. Great on there. I'm looking to see if there's any other questions. Yes, it works for lap band too. Very, very good questions. And all you late night people up watching Periscope and Facebook, I'm impressed. Any suggestions for crazy high metabolized cortisol levels? Metabolized cortisol. I'm assuming you've had your cortisol checked and your cortisol is high. Now, cortisol can be driven by a number of factors. Cortisol is produced by the adrenal glands, but I see a number of women who come into me that have very high stress jobs, very high stress lives, and they have this borderline elevated cortisol level. And now cortisol turns on the production of glucose and drives the process of insulin resistance to worsen. So the key with high cortisol is, number one, increase the fat, decrease inflammation, and look for some way to lower your stress. Getting adequate sleep plays a role there. Almost 5 a.m. in the UK. What are you doing up at 4 o'clock in the morning watching me in the UK? Like, you guys are upside down on the other side of the world, supposed to be asleep. Tap your screen for more hearts. Yes, thank you guys. I appreciate that. Seriously, if you're not on Periscope, if you guys are watching Periscope, they're asking all sorts of goofy questions. Lots of good questions, actually. Great questions, you guys. Again, my name is Dr. Adam Nally. I'm a board-certified family physician and obesity medicine specialist in Surprise, Arizona, a northwest suburb of Phoenix. I've been in practice for about 15 years. If you want to learn more about this cool stuff, go to docmuscles.com, docmuscles.com. You can click on the link either above or below. If you're on Facebook Live, it's below. Periscope is below. Facebook Live is above. On that website, click on my 6-part free weight loss mini course. It'll give you 6 emails that'll come out and give you a lot of information. Sounds like I'm starting to lose a connection with Periscope. I apologize there. It looks like the Facebook Live may have gotten interrupted too. That's bad. Oh no. If I lost my internet connection, I'm actually recording this, so I'll probably post this recording up on Facebook in just a minute. So hopefully that'll replace it, so it's not a big challenge for those that just lost me. Every time I do that, I pull up Facebook and it sucks up my bandwidth. I'm out on the edge of town, and so I think that's the problem. They said I had lots of bandwidth, but not lost, but I'm freezing. So when I go Is it frozen like that? It might be. I don't know. Hopefully it's not bad. Well, thanks for sticking with me, you guys. It's late. I'm going to sign off, but that is the that's my scope tonight on how ketosis relates to insulin resistance and disease. Tune in tomorrow when I'm going to talk about what are the diseases of civilization and how does ketosis begin to treat them. And then we'll go in and we'll address the diseases of civilization little by little. So keep up the good work. Keep the carbs low. Keep the fat high. And you guys have a great night and have a wonderful evening. Go check me out at docmuscles.com and sign up for my weight loss mini course. Check out my vitamin supplements and check out exogenous ketones at dynamicketones.com as well. Have a great night, and we'll talk to you guys soon. Take care. Bye-bye.